Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
Which is a recommended guideline for safe computerized charting? 1. Passwords to the computer system should only be changed if lost. 2. Computer terminals may be left unattended during client care activities. 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. 4. Copies of printouts from computerized files should be kept on a clipboard at the nurse's station for other nurses to access. The correct answer is 3. Accidental deletions from the computerized file need to be reported to the nursing manager or supervisor. After any inadvertent deletions of permanent computerized records, the nurse should type an explanation into the computer file with the date, time, and his or her initials. The nurse should also contact the nursing manager or supervisor with a written explanation of the situation. Options 1, 2, and 4 represent unsafe charting actions. Only option 3 follows the guidelines for safe computer charting.
A patient is scheduled for endoscopic carpal tunnel release surgery in the morning. What would the nurse be sure to teach the patient? 1. Pain and numbness are expected to be experienced for several days to weeks. 2. Immediately after surgery, the patient will no longer need assistance. 3. After surgery, the dressing will be large and there will be lots of drainage. 4. The patient's pain and paresthesia will no longer be present. The correct answer is 1. Pain and numbness are expected to be experienced for several days to weeks. Rationale. Postoperative pain and numbness occur for a longer period of time with endoscopic carpal tunnel release than with an open procedure. Patients often need assistance post-operatively, even after they are discharged. The dressing from the endoscopic procedure is usually very small, and there should not be a lot of drainage.
Which of the following physical sensations will the client who has had an abdominal hysterectomy most likely experience if she hyperventilates while performing deep breathing exercises? 1. Dyspnea. 2. Dizziness. 3. Blurred vision. 4. Mental confusion. The correct answer is 2. Dizziness. Hyperventilation occurs when the client breathes so rapidly and deeply that she exhales excessive amounts of carbon dioxide. A characteristic symptom of hyperventilation is dizziness. To avoid hyperventilation, the nurse should assist the client in the practice of slow, deep breathing in a regular breathing pattern. Dyspnea, blurred vision, and mental confusion are not associated with hyperventilation. The nurse is unable to palpate the client's left pedal pulses. Which of the following actions should the nurse take next? 1. Auscultate the pulses with a stethoscope. 2. Call the physician. 3. Use a Doppler ultrasound device. 4. Inspect the lower left extremity. The correct answer is 3. Use a Doppler ultrasound device. When pedal pulses are not palpable, the nurse should obtain a Doppler ultrasound device. Auscultation is not likely to be helpful if the pulse isn't palpable. Inspection of the lower extremity can be done simultaneously when palpating, but the nurse should first try to locate a pulse by Doppler. Calling the physician may be necessary if there is a change in the client's condition. The nurse is teaching a client about risk factors associated with atherosclerosis and how to reduce the risk. Which of the following is a risk factor that the client is not able to modify? 1. Diabetes. 2. Age. 3. Exercise level. 4. Dietary preferences. The correct answer is 2. Age. Age is a non-modifiable risk factor for atherosclerosis. The nurse instructs the client to manage modifiable risk factors such as comorbid diseases, such as diabetes, activity level, and diet. Controlling serum blood glucose levels, engaging in regular aerobic activity, and choosing a diet low in saturated fats can reduce the risk of developing atherosclerosis. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A 36-year-old female client has been diagnosed with hemorrhoids. Which of the following factors in the client's history would most likely be a primary cause of her hemorrhoids? 1. Her age. 2. 3 vaginal delivery pregnancies. 3. Her job as a school teacher. 4. Varicosities in her legs. The correct answer is 2. 3 vaginal delivery pregnancies. Hemorrhoids are associated with prolonged sitting or standing, portal hypertension, chronic constipation, and prolonged increased intra-abdominal pressure as associated with pregnancy and the strain of vaginal delivery. Her job as a school teacher does not require prolonged sitting or standing. Age and leg varicosities are not related to the development of hemorrhoids. The home health nurse is obtaining a history for a patient who has deep vein thrombosis and is taking warfarin 2 milligrams per day. Which statement by the patient is the best indicator that additional teaching about warfarin may be needed? 1. I have started to eat more healthy foods like green salads and fruit. 2. The doctor said that it is important to avoid becoming constipated. 3. Warfarin makes me feel a little nauseated unless I take it with food. 4. I will need to have some blood testing done once or twice a week. The correct answer is 1. I have started to eat more healthy foods like green salads and fruit. Patients taking warfarin are advised to avoid making sudden dietary changes because changing the oral intake of foods high in vitamin K will have an impact on the effectiveness of the medication. The other statements suggest that further teaching may be indicated, but more assessment for teaching needs is required first. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? 1. Feed a client who is post-operative tonsillectomy the first meal of clear liquids. 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. 3. Obtain a throat culture on a client diagnosed with bacterial pharyngitis. 4. Escort the client diagnosed with laryngitis outside to smoke a cigarette. The correct answer is 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. Clients with colds are encouraged to drink 2,000 milliliters of liquids a day. The UAP could do this. Tonsillectomies cause throat edema and difficulty swallowing. The nurse must observe the client's ability to swallow before this task can be delegated. Throat swabs for culture must be done correctly, or false negative results can occur. The nurse should obtain the swab. Clients with laryngitis are instructed not to smoke. Smoking is discouraged in all healthcare facilities. Sending nursing personnel outside encourages an unhealthy practice, which is not the best use of the personnel. Interventions requiring assessment, teaching, and evaluation cannot be delegated. Levels of activities being delegated should be appropriate for the level of training of the staff member carrying out the task. Tasks delegated must conform to safe healthcare practice. The client calls the clinic and says, "I am having chest pain. I think I'm having another heart attack." Which intervention should the nurse implement first? 1. Call 911 Emergency Medical Services. 2. Instruct the client to take an aspirin. 3. Determine if the client is at home alone. 4. Ask if the client has any sublingual nitroglycerin. The correct answer is 4. Ask if the client has any sublingual nitroglycerin. Because the client has had one MI, the client may have sublingual nitroglycerin, a coronary vasodilator, in a pocket and can take it immediately. If the client does not have any on the body, then the nurse should determine if there is anyone in the home that can help the client.
A woman of African descent had experienced severe palpitations, weakness, and shortness of breath after taking bacitracin. As a part of the discharge planning, the nurse should evaluate the client's knowledge about 1. Increased folic acid needs. 2. Congenital enzyme deficiency. 3. Restricted activity in hot weather. 4. Need for blood transfusions. The correct answer is 2. This client presented with the typical signs of glucose 6-phosphate dehydrogenase, aka G6PD, deficiency anemia. 10% of blacks inherit an X-linked recessive disorder of the G6PD enzyme in the red blood cell. When cells with decreased levels of G6PD are exposed to certain drugs, such as sulfonamides, acetylsalicylic acid, thiazide diuretics, and vitamin K, the RBC may hemolyze an anemia and jaundice may occur. The reaction is self-limited as soon as the causative agent is withheld. No further treatment is necessary except counseling to prevent acute incidents by avoiding exposure to specific drugs. There is no need for increased folic acid, restricted activity in hot weather, or blood transfusions.
Amoxicillin trihydrate 300 mg PO has been prescribed for a client with an oral infection. The medication is available in a liquid suspension that is available as 250 mg per 5 milliliters. How many milliliters should the nurse administer? Blank milliliters. The correct answer is 6 milliliters. To solve this problem, you set up the formula as 250 milligrams over 5 milliliters equals to 300 milligrams over x. You cross-multiply 250 times x and 300 times 5. You get 250x equals to 1,500. You divide 200 on both sides, and you get x equals to 6 milliliters. This is the amount that the nurse should administer for each dose.
A client has had a pulmonary artery catheter inserted. In performing hemodynamic monitoring with a catheter, the nurse will wedge the catheter to gain information about which of the following? 1. Cardiac output. 2. Right atrial blood flow. 3. Left end diastolic pressure. 4. Cardiac index. The correct answer is 3. Left end diastolic pressure. Rationale. When wedged, the catheter is pointing indirectly at the left end diastolic pressure. The pulmonary artery wedge pressure is measured when the tip of the catheter is slowing inflated and allowed to wedge into a branch of the pulmonary artery. Once the balloon is wedged, the catheter reads the pressure in front of the balloon. During diastole, the mitral valve is open, reflecting left ventricular end diastolic pressure. Cardiac output is the amount of blood ejected by the heart in 1 minute and is determined through thermodilution and not wedge pressure. Cardiac index is calculated by dividing the client's cardiac output by the client's body surface area and is considered a more accurate reflection of the individual client's cardiac output. Right atrial blood pressure is not measured with the pulmonary artery catheter.
An anxious patient repeatedly uses the call bell to get the nurse to come to the room. Finally, the nurse says to the patient, "If you keep ringing, there will come a time I won't answer your bell." Which legal term is related to this statement? 1. Slander. 2. Battery. 3. Assault. 4. Libel. The correct answer is 3. Assault. This scenario is an example of assault. Assault is a verbal attack or unlawful threat causing a fear of harm. No actual contact is necessary for a threat to be an assault. Slander is a falsely spoken statement resulting in damage to a person's character or reputation. Battery is the unlawful touching of a person's body without consent. Libel is a false printed statement resulting in damage to a person's character or reputation.
The charge nurse assigns the nursing care of a patient who has just returned from open carpal tunnel release surgery to an experienced LPN/LVN. Which instructions would the charge nurse provide for the LPN/LVN? Select all that apply. 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. 4. The patient will no longer need pain medication. 5. Check the neurovascular status of the fingers every hour. 6. Instruct the patient to perform range of motion on the affected wrist. The correct answers are 1. Check the patient's vital signs every 15 minutes in the first hour. 2. Check the dressing for drainage and tightness. 3. Elevate the patient's hand above the heart. And 5. Check the neurovascular status of the fingers every hour. Rationale. Post-operatively, patients undergoing open carpal tunnel release surgery experience pain and numbness, and their discomfort may last for weeks to months. Hand movements may be restricted for 4 to 6 weeks after surgery. All of the other directions are appropriate for the postoperative care of this patient. It is important to monitor for drainage, tightness, and neurovascular changes. Raising the hand and wrist above the heart reduces the swelling from surgery, and this is often done for several days.
Which nursing measure would most likely relieve post-operative gas pains after abdominal hysterectomy? 1. Offering the client a hot beverage. 2. Providing extra warmth. 3. Applying a snugly fitting abdominal binder. 4. Helping the client walk. The correct answer is 4. helping the client walk. The discomfort associated with gas pains is likely to be relieved when the client ambulates. The gas will be more easily expelled with exercise. The anesthesia, analgesics, and immobility have altered normal peristalsis. Peristalsis will be stimulated by exercise. Offering a hot beverage, providing extra warmth, and applying an abdominal binder are not recommended and could aggravate the discomfort of post-operative gas pains. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which patients would be best to assign to the most experienced nurse in an ambulatory care center that specializes in vision problems and eye surgery? Select all that apply. 1. Patient who requires post-operative instructions after cataract surgery. 2. Patient who needs an iPad and a metal shield applied. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 4. Patient who needs teaching about self-administration of eye drop. 5. Patient who requires an assessment for recent and sudden loss of sight. 6. Patient who requires preoperative teaching for laser trabeculoplasty. The correct answers are 1. Patient who requires post-operative instructions after cataract surgery. 3. Patient who requests a home health referral for dressing changes and eye drop installation. 5. Patient who requires an assessment for recent and sudden loss of sight. And 6. Patient who requires preoperative teaching for laser trabeculoplasty. Providing post-operative and preoperative instructions, making home health referrals, and assessing for needs related to loss of vision should be done by an experienced nurse who can give specific details and specialized information about follow-up eye care and adjustment to loss. The principles of applying an iPad and shield and teaching the administration of eye drops are basic procedures that should be familiar to all nurses. A nursing student is assisting an older patient who has decreased vision related to macular degeneration. The patient is alert, conversant, and cognitively intact. When would the supervising nurse intervene? 1. Student puts the call bell and personal items within reach and locates each item by guiding the patient's hand. 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. 3. Student talks to the patient about family and asks, "So, when was the last time that you saw your uncle?" 4. Student assists during mealtime by opening packages and describing location of foods by using clock coordinates. The correct answer is 2. Student closes the curtains and turns off all of the lights at the end of the shift to encourage rest and sleep. For patients who retain some vision, the room should be well lit. Even at night, there should be a nightlight. Other options are correct actions. Words such as see, look, or view are parts of normal speech, and it's acceptable and natural to use these terms.
When beginning IV erythropoietin therapy, the nurse should do which of the following? Select all that apply. 1. Check the hemoglobin levels before administering subsequent doses. 2. Shake the vial thoroughly to mix the concentrated white, milky solution. 3. Keep the multi-dose vial refrigerated between scheduled twice-a-day doses. 4. Administer medication through the IV line without other medications. 5. Adjust the initial doses according to the client's changes in blood pressure. 6. Instruct the client to avoid driving and performing hazardous activity during the initial treatment. The correct answers are 4, 5, and 6. Erythropoietin is administered to decrease the need for blood transfusions by stimulating red blood cell production. The medication should be administered through the IV line without other medications to avoid a reaction. The hematocrit, a simple measurement of the percentage of RBCs in the total blood volume, is used to monitor this therapy. When initiating IV erythropoietin therapy, the nurse should monitor the hematocrit level so that it rises no more than 4 points in any 2-week period. In addition, the initial doses of erythropoietin are adjusted according to the client's changes in blood pressure. The nurse should tell the client to avoid driving and performing hazardous activity during the initial treatment due to possible dizziness and headaches secondary to the adverse effect of hypertension. The hematocrit, not the hemoglobin level, is used for monitoring the effectiveness of therapy. The vial of erythropoietin should not be shaken because it may be biologically inactive. The solution should not be used if it is discolored. The nurse should not re-enter the vial once it has been entered. It is a one-time use vial. All remaining erythropoietin should be discarded since it does not contain preservatives.
A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden sharp pain in the mid-epigastric region along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. Notify the physician. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize perforation. A nasogastric tube may be used following surgery.
When monitoring a client who is receiving tissue plasminogen activator, TPA, the nurse should have resuscitation equipment available because reperfusion of the cardiac tissue can result in which of the following? 1. Cardiac arrhythmias. 2. Hypertension. 3. Seizure. 4. Hypothermia. The correct answer is 1. Cardiac arrhythmias. Rationale. Cardiac arrhythmias are commonly observed with administration of TPA. Cardiac arrhythmias are associated with reperfusion of the cardiac tissue. Hypotension is commonly observed with administration of TPA. Seizures and hypothermia are not generally associated with reperfusion of the cardiac tissue.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for the pregnant client in labor. The client has had no prenatal care and reports being dependent on opioids throughout her pregnancy. Which interventions for pain control could be provided to this client? Select all that apply. 1. Epidural anesthesia. 2. Budorphanol IV. 3. Morphine IV. 4. Acetaminophen PO. 5. 1% lidocaine locally. The correct answers are 1. Epidural anesthesia. 3. Morphine IV. 4. Acetaminophen PO. And 5. 1% lidocaine locally. Epidural anesthesia is not contraindicated in the opioid-dependent client and is an acceptable form of pain management. If narcotics can be safely administered, the nurse should not withhold the medication during labor. Giving opioids during acute pain does not enhance an opioid-addicted client's chemical dependence. Acetaminophen administered orally can reduce pain in early labor. 1% lidocaine can be administered by the HCP prior to an episiotomy or for perineal repair. Budorphanol is a narcotic agonist-antagonist and should be avoided in the opioid-dependent client as it can cause acute withdrawal in the mother and in utero withdrawal in the fetus, characterized by fetal tachycardia and fetal death.
A patient with a right above the knee amputation asks the nurse why he has phantom limb pain. What is the nurse's best response? 1. Phantom limb pain is not explained or predicted by any one theory. 2. Phantom limb pain occurs because your body thinks your leg is still present. 3. Phantom limb pain will not interfere with your activities of daily living. 4. Phantom limb pain is not real pain but is remembered pain. The correct answer is 1. Phantom limb pain is not explained or predicted by any one theory. Rationale. 3 theories are being researched with regard to phantom limb pain. The peripheral nervous system theory suggests that sensations remain as a result of the severing of peripheral nerves during the amputation. The central nervous system theory states that phantom limb pain results from a loss of inhibitory signals that were generated through afferent impulses from the amputated limb. The psychological theory helps predict and explain phantom limb pain because stress, anxiety, and depression often trigger or worsen a pain episode.
A client with colon cancer is having a barium enema. The nurse should instruct the client to take which of the following after the procedure is completed? 1. Laxative. 2. Anticholinergic. 3. Antacid. 4. Demulcent. The correct answer is 1. Laxative. After a barium enema, a laxative is ordinarily prescribed. This is done to promote elimination of the barium. Retained barium predisposes the client to constipation and fecal impaction. Anticholinergic drugs decrease gastrointestinal motility. Antacids decrease gastric acid secretion. Demulcents soothe mucous membranes of the gastrointestinal tract and are used to treat diarrhea. Which of these patients who have just arrived at the emergency department should the nurse assess first? 1. Patient who reports several dark, tarry stools and a history of peptic ulcer disease. 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. 3. Patient who has pernicious anemia and reports paresthesia of the hands and feet. 4. Patient with thalassemia major who needs a scheduled blood transfusion. The correct answer is 2. Patient with hemophilia A who is experiencing thigh swelling after a fall. Thigh swelling after an injury in a patient with hemophilia likely indicates acute bleeding, which can compromise blood flow and nerve function in the leg, and should be treated immediately with the administration of factor replacement. The other patients also need assessment, treatment, or both, but the data do not indicate any immediate threat to life or function. The home healthcare nurse is talking on the telephone to a male client diagnosed with hypertension and hears the client sneezing. The client tells the nurse he has been blowing his nose frequently. Which question should the nurse ask the client? 1. Have you had the flu shot in the last 2 weeks? 2. Are there any small children in the home? 3. Are you taking over-the-counter medicine for these symptoms? 4. Do you have any cold sores associated with your sneezing? The correct answer is 3. Are you taking over-the-counter medicine for these symptoms? A client diagnosed with hypertension should not take many of the over-the-counter medications because they work by causing vasoconstriction, which will increase the hypertension. Influenza is a viral illness that might cause these symptoms. However, an immunization should not give the client the illness. Coming into contact with small children increases the risk of contracting colds and the flu, but the client has a problem, not just a potential one. Cold sores are actually an infection by the herpes simplex virus. Colds and cold-like symptoms are caused by the rhinovirus or influenza virus. The term cold sore is a common term that still persists in the populace. The keys to answering this question are the words hypertension and cold. Anytime a client has a chronic illness, the client should discuss over-the-counter medications with the healthcare provider or a pharmacist. Many of the routine medications for chronic illnesses interact with over-the-counter medications. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.